Hang on, let me just check. Okay. Good morning. My name's Kiara. I'll be performing your imaging today. Before we begin, can you please tell me your full name and your date of birth?
Of course you can, darling. My name is Jane Ann Doe, and I was born on the 1st of the 1st, 1960.
Thank you. Do you know what imaging you're coming in for today, Jane?
Oh, yes, my doctor said it's some sort of radioactive test which will look at my heart.
Yeah, so today's test is called a PET-CT myocardial viability scan. So essentially what this means is we're going to be having a look at your heart's muscles, which is called the myocardium. We're just going to see how well it's functioning and the status of those muscles. Do you have any questions so far, Jane?
Nope, sounds good so far, dear.
Perfect. So quickly looking over your referral for today's scan, I can see you recently had one of our nuclear medicine myocardial perfusion SPECT tests done last week. Is this correct?
Yes, my doctor has referred me for so many scans lately, but that sounds familiar. The poor guy had such difficulty finding my veins for the injection, and I had to have that awful drug that made me feel all hot and sweaty.
Yeah. That would have likely been the pharmaceutical stressor that they gave you. So, as you may remember from that scan, the results are used to determine if there's any damage to the heart's muscles and helps us identify any regions of decreased blood supply. Just want to quickly confirm the results from last week's scan have been discussed with you with your doctor.
Oh, yes, Dr. John Doe is excellent. He went through all the results with me and showed me all the excellent photos of my heart.
Great. So, as you're aware, last week's scan identified some potential damage to some select areas of your myocardium during your resting state. That is just when you're relaxing in your day to day. So, today's scan is designed to build upon last week's scan and provide some additional information of the function of those areas. What can happen occasionally is the myocardium muscle receives less blood than it requires to function successfully. And as a result, it enters a state called hibernation. This occurs when the tissue is still alive and the damage is reversible, but there is an overall reduction of function. Any questions so far?
So, if my muscle isn't in that state you said, what does that mean?
Great question. So, unfortunately, if the tissue doesn't appear to be in the hibernating state on our scan today, it is indicative of myocardial scarring. In this case, the tissue is not functional and the damage cannot be reversed. However, there are a bunch of medical treatment options if that is the case.
Okay, thanks, darling. I'm sure Dr. John Doe will take care of me if that's the case.
So today's scan will allow our radiologist to determine if the myocardium is in hibernating state and the best future route, such as revascularization or medical treatments. Any questions?
No.
Great. Before I explain the steps involved in today's scan, when was the last time you had anything to eat or drink?
Oh, I haven't had anything to eat since last night. Missed my poor cup of tea and my late night bickies.
Perfect. Are you a diabetic at all, Jane?
Nope, although my mother was a diabetic. Does that matter?
No, that's okay. Just need to quickly check your blood sugar levels before we go ahead. Is this okay?
Yep, whatever you need, darling.
Thank you. Great. Your blood sugar is within the range. So today's scan has two parts. The first part involves what we call a glucose oral load, which is just essentially a sugary drink that I'll ask you to drink. Then I'm going to leave you to relax in this room for about 30 minutes to 60 minutes before giving you an injection of a radiopharmaceutical called FDG. This will go into the vein of your arm. We may continue to monitor your blood sugar levels throughout this wait time, and FDG accumulates within your myocardium in areas where the glucose or sugar is being used. Once you've given you the FDG injection, I'll leave you again for about 45 minutes, and then I'll bring you back through to the camera room and we'll get you set up. Any questions?
You mentioned the radioactive thing. My friend had something similar done a few months back, and she was telling me all about how they made her stay in hospital in an isolated room for a week, and she couldn't touch anyone or go outside. Is this the same idea? Should I not go straight home after this?
The radiation level in this injection we give today is relatively low, so there's no radiation risk to others in your household. The general advice we give is you should avoid close contact, such as hugging or sitting directly next to someone for the rest of today. But from then, everything tomorrow you can do as per normal.
Oh, okay, great. Thanks.
So just checking, are you happy to proceed with today's imaging, Jane?
Yep.
Great. I will just get you to lay on the imaging bed on your back with your feet down the end here. And next, I'm just going to get you into a position with your arms above your head for the duration of the scan. It's going to take about 10 to 30 minutes.
Okay.
That's it.